Hi, hello, and welcome to my overview of the Medicare system. My name is David Treadway. I'm owner of Precision Retirement Planning, LLC. I thank you for checking out my video today. I'm going to go through just a broad spectrum of things that you need to know when you're turning 65 and then also shortly thereafter. Here you go. Here's, at minimum, what you should begin to start looking through to understand Medicare and what all your options are. You really need to do this. You don't need to go through absolutely every page of this, but you need, at minimum, the Medicare and You guidebook. That book has 90% of the answers that you will need to answer the questions that you have about Medicare and the options that you have to make sure that you're protecting yourself and your family for your health care needs during retirement. So if you want to go through all of those in detail, you're certainly welcome to. The information is available and it is out there, and I get that. I understand that. I'm a nuts and bolts, hands-on type of person. When I used to work at UPS, my manager used to say that I was a bottom of the basement of the science building kind of guy. I needed to know the answers to everything and how they worked. So I get it. If you're that type of person, more power to you. Do your homework, make the right decision. The biggest advice that I can give is that you need to know and make the right decision, because you may only get one chance to make the right decision with your Medicare and the additional insurance that you need to protect yourself. So if you'd like my help, obviously that's why I'm here. Please give me a call. Happy to help you. I'm an independent agent. I work for you. I don't work for a specific insurance company. I represent them all. And I can find the best thing to meet your needs, the best policy, the best plan, and help you through it. That's what I do for a living. So I do this also. That's no out-of-pocket cost to you. The insurance companies pay me. That's a mutual benefit to the company, to myself, and to you. So we're here. There's lots of skilled people too. Get the help if you need it. You don't want to make a mistake, because you may not be able to fix it if you make the wrong one. So here are some of the materials. The best to answer the majority is a publication from the U.S. government, the Center for Medicare and Medicaid Services, the Medicare and You guidebook. If you don't have it, you can either download it directly from Medicare.gov. You can find it on my website at medsup.net, medsup.net. I have a second website, precisionretirement.com. You can find it there as well. You can download it, or you can get I like print copies, so I just I logged on Medicare.gov, ordered one, about 2 weeks it arrived in my mailbox. Nice thing is that it's actually specific. In my case, I live in Ohio, so it's specific to Ohio, and it has very specific information in the back of it. So whatever state you were in, that should apply. Here are a few other publications you need to check out. This is a really good one, Medicare Basics. This is a couple years old, but it's a nice planning guide. It has some worksheets and some good things to consider in there. You have Understanding Medicare Part C and D, enrollment periods. A lot of these timelines, I'm going to give you a brief overview today, but there are some very tricky and specific timelines that revolve around different times in your life, as well as your age and employer coverage. So you need to be knowledgeable of those. There are a whole lot of other publications. Here's one that I suggest you check out. This is the Choosing a Medigap Policy guide. Again, this is from Centers for Medicare and Medicaid Services. Excellent resource. Great reference. Again, I'm going to talk a little bit about Ohio, because that's where I'm based. Ohio Department of Insurance has a very good website and a very good team to help Medicare recipients or beneficiaries. This is a guidebook specific to Ohio. Again, Guide to Medicare, Supplement Insurance, Medicare Options, and Part D. Great book. Now, a couple points. In the United States, there are roughly 10,000 people every day turning 65 and becoming eligible for Medicare. In Ohio, that's 10,000 a month. I'm not sure if I said that right before, but in the U.S., there's 10,000 people per day turning 65. In Ohio, it's 10,000 people per month turning 65. Luckily, Ohio recognizes that, so through their Medicare division, they do have some outreach, and they go around the state and they give talks on important things that you need to know. This is the presentation I believe they're using. That's right on their website as well. Very good. Some great pointers in there. But they have 5 people doing those outreaches to cover 10,000 people per month. So they are stretched thin. But nonetheless, if you want to go directly through the state, you can try to get their assistance. That's insurance.ohio.gov. And you can look at the Medicare Services tab. And you can find an area called OSHIP, which is Ohio State Health Insurance Assistance Program. Every state in the country has a SHIP program, and you can locate those directly from shiptacenter.org if you want to work directly with your state. Some states have more robust programs than others, and I think Ohio's is very good, so check it out if you want to go through there. Their hotline in Ohio is 1-800-686-1578. Again, I'll give some kudos to Ohio. This program's robust. The back of it actually has rates in it. So you can take a look at what rates are for certain additional coverage that you can get. Virginia, same thing. They publish rates. I couldn't find Texas, but Virginia, you log on to the Department of Insurance website and you can find rates specific to Virginia. I'll take a look, just flip through this. Ohio Department of Insurance, welcome to Medicare. This is what they cover in their outreach. What is Medicare? They really split it in two. There's 2 options. You get original Medicare plus secondary insurance plus prescription coverage, or you try to wrap it in one ball of wax with the Medicare Advantage plan, which is Part C. I'll cover that here in a little bit. They go through applying for Medicare, and I'll talk about that here as well. There's some important timelines. They give you an overview of Part A, Part B, C, and D. I'm going to do that here shortly as well. They cover some of the preventive benefits that come with Medicare. They go through some of the costs. I'm going to cover that here shortly as well. Secondary insurance, which is another one of your critical decisions. Secondary insurance is necessary. Medicare A and B simply don't cover everything. You have deductibles and co-insurance and a lot of exposure there if you don't get secondary insurance. So you'll need to evaluate what makes the most sense for you and your family, whether that be through Part C or a Medigap plan. They go through Medigap plans, how they're standardized, no network, some of the pros and cons. Part D, drug coverage. I'll touch on that here briefly. Part D stands for drug. I'm not going to talk a whole lot about it today. Simple fact with Part D is if you need help, there's no replacement for going directly to Medicare. You can do that through Medicare.gov or give them a call at 1-800-MEDICARE. They are excellent. They can review your list of prescriptions and give you the best options for coverage, and they can even enroll you pretty quickly. So no substitute for working directly through Medicare for your Part D. They go through Part D costs, how you should review it each year, and again, how they split Medicare options really into 2 different channels. So Ohio State, or the state of Ohio, doing a very good job. Outreach to the seniors or boomers turning 65, 10,000 each month. Okay, so now I'm going to go through an overview of Medicare in general. I'm going to cover a few things. What's covered by Medicare, costs at a glance, signing up for Medicare, Part C, what is Part C or an Advantage plan, Medigap, what are Medigap plans, and then I'll do a comparison of Part C and Medigap plans. And that will complete my overview. Each of these areas can have their own training, and I will be developing that. So if you want to subscribe to my YouTube channel or check back to my website, you'll find more detailed information. You can always call me as well, 937-506-0591. You can email me at david@medsup.net, MEDSUP or david@precisionretirement.com. So with that, we'll go ahead and dive in. What does Medicare cover? Well, Part A covers, and I'm taking this, by the way, directly from Medicare.gov. They have really a nice site, pretty simple. Check it out. I printed right off there. What does Part A cover? Covers services like lab tests, surgeries, doctor visits, and supplies. Hospital generally is what most people say. And they have 5 categories here. And I'll go through the top 2 in more detail. All you do is click on them and it'll give you the detail that I'm going to read you here in a minute. But hospital care, number 1, skilled nursing, nursing home care, hospice, and home health services. They do not cover long-term care, but those are the 5 categories right from Medicare.gov that Part A covers. Medicare coverage is based on 3 main factors: federal and state law, national coverage decisions made by Medicare, and local coverage decisions made by companies in each state that process claims for Medicare. So at a high level, that's Part A. Number 1, again, hospital care. I'll dive into that one a little bit. It covers hospital services, including semi-private rooms, meals, general nursing, drugs, etc. These are acute care hospitals, critical access hospitals, inpatient rehab, and long-term care hospitals. What's not covered? Private duty nursing, private room, television and phone if they're separately billed, and personal care items. So who is eligible? This is an interesting point that's changed over the last few years, but a person needs to have an order from a doctor that says 2 or more midnights are medically necessary, and you need to be formally admitted. There's been a change over the last few years where hospitals are keeping patients for observational status, and that does not qualify you for Part A benefits. So those are the coverages for inpatient hospital care, a generalization. And here are the costs. Here's how it works. You have a $1,316 deductible in 2017 for each benefit period. I stress benefit period because that's a defined term. I'll describe that here shortly. After you meet that $1,316 deductible, you then for the first 60 days have 0 coinsurance. No coinsurance for the first 60 days. The 61st through the 90th day, you have a $329 per day coinsurance. After the 90th day, you have a $658 per day coinsurance with a lifetime reserve days of 60 days. So a lot of exposure there. I'll talk about the benefit period. Again, benefit period is 60 days. So it is not an annual basis. That deductible, $1,316, is due for each benefit period. And what a benefit period is once you enter the hospital, you then have to be outside of the hospital for 60 days. If you're out, receive no skilled nursing services or hospital services for 60 days, and then you go into the hospital again, that's a brand new benefit period, and all those fees would then apply again. So I'm going to move on to skilled nursing under Part A. Skilled nursing can be covered after a 3-day inpatient hospital stay. That's a requirement. So you need to be in for 3 days. The cost for skilled nursing care, first 20 days, $0. Days 21 through 100, you have coinsurance of $164.50 per day. In days 100 and beyond, you are responsible for all costs. So that's how skilled nursing works under Part A. What does Part B cover? Part B covers 2 types of services. 1, medically necessary services, and preventive services like a flu shot or a checkup. There are 2 ways to find out if Medicare covers what you need. You can talk to your doctor, or you can contact Medicare. You can go right to Medicare.gov, type it in, or give them a call, 1-800-MEDICARE. So that is Part B. 2017 costs at a glance. Again, this comes directly from Medicare.gov. These are the costs for Part A and Part B. Part A premiums. How much does it cost just to have Part A? Well, for most people, there is no premium. If you paid Medicare taxes or more, there is no premium for you. If you work less than that, you can pay up to $413 each month just to have Part A. Part B premium. In 2017, the standard Part B premium is $134. The average is less than that. If you're on Social Security and have it deducted, it's less. It's $109 on average. Now, if you're high income, yours could be more. If you're an individual with more than $85,000 of income, then you'll begin to pay more than the standard premium for Part B. Joint filer, that number is $170,000 per year, and there are bands that can be more. If you earn more than $107,000 for an individual or $214,000 joint filers, your premiums would then be $267.90. Again, this is right on Medicare.gov, and you can see what your particular premium would be for Part B. Part C premium, that's an Advantage plan. We'll cover that here in just a moment. And Part D, again, Medicare.gov can get you that. Okay, other costs associated with Part B. There are deductibles and coinsurance. So currently, 2017, the deductible is $183 per year. Now, this is on an annual basis. After you meet that for the year, you don't have to pay that. Then there is coinsurance. 20% is your responsibility. So a lot of exposure with A and B. So Part A, you have multiple benefit periods potentially during the year. You have typically no premiums, but a $1,316 deductible. And then you also have potential for coinsurance depending on how long your hospital or skilled nursing care stay would be. That's Part A. Part B, you do have a premium, and then you also have a deductible, and then you also have a 20% responsibility for coinsurance. So a lot of exposure there. That's why at the beginning I said Part A and Part B Medicare is not enough. You need secondary insurance of some form and a plan to make sure that you're protected. So those are some of the costs at a glance for Part A and Part B. We'll now take a look at signing up for Medicare. I'm going to take that directly out of the Medicare NU guidebook. There are, again, as I mentioned, a lot of different timelines depending on your specific situation. I'm going to go through a few of the timelines here just so you understand the basic timelines for getting signed up for Medicare. That's, again, signing up for Medicare, Parts A and Part B. If you're already getting benefits from Social Security or the Railroad Retirement Board, you'll automatically get Part A and Part B starting the first day of the month that you turn 65. If you're under 65 and disabled, you'll also automatically get Part A and Part B after you get disability benefits from Social Security or the Railroad Retirement Board for 24 months. A couple other situations, if you have ALS, also called Lou Gehrig's disease, you'll get Part A and B automatically the month your Social Security disability benefits begin. If you're automatically enrolled, you'll get your red, white, and blue Medicare card automatically in the mail 3 months before your 65th birthday. Some people have to sign up for Parts A and Part B. If you're close to 65 but not getting Social Security or Railroad Retirement Board benefits, you'll need to sign up for Medicare. If you have end-stage renal disease and want Medicare, you'll also need to sign up. Contact Social Security to find out when and how to sign up for Part A and Part B. I do have to mention that rules in Puerto Rico are a little bit different. If you live in Puerto Rico, please check those out. And where can I get more information? You can get it from Social Security at 1-800-772-1213. Now, when can you sign up? That's pretty important. If you're eligible for free Part A, you can sign up for Part A once your initial enrollment period starts. Your Part A coverage will start 6 months back from the date you apply for Medicare, but no earlier than the first month you were eligible. There are really 3 enrollment periods. I'm going to cover the initial enrollment period, but there's an initial enrollment period, a special enrollment period, and a general enrollment period. The initial enrollment period is one of the most important. You can first sign up for Part A if you have to buy it, or Part B during the 7-month period that begins 3 months before the month you turn 65. It also includes the month you turn 65, and it ends 3 months after the month that you turn 65. Important notes with those: when you get coverage depends on when you apply for it. If you sign up for Part A and Part B during the first 3 months of your initial enrollment period, in most cases your coverage starts the first day of your birthday month. If your birthday's on the first day of the month, it will actually start the month prior. If you enroll in Part A and or Part B the month you turn 65 or the last 3 months of your initial enrollment period, the start date for your Medicare coverage will be delayed. The system needs time to get this effective, so apply early. Don't wait. Look at it as 3 months prior to your birthday month. Special enrollment period, you can have that if you elect to stay on employer coverage and take Part B at a later date. And then you have a general enrollment period if you didn't sign up for Part A or have to buy it, and or Part B during the initial enrollment period, and you don't qualify for a special enrollment period. Now this probably comes with penalties too, and this guidebook will tell you about those penalties. The general enrollment period is January 1 through March 31 each year, and the coverage won't start until July 1st of that year. And then you may have, again, to pay a higher Part A or B premium for late enrollment, and you don't pay just for that year, you pay for the rest of your life. So that's why I say these are very critical timelines, very critical decisions that you need to get right the first time. That's how you sign up for Medicare. You can contact Medicare.gov or 1-800-Medicare to get signed up. We'll take a look at Part C next. Again, I'm taking this straight from the book. Learn about Medicare Advantage plans, Part C. I'm going to do a brief overview here, and then I'll do the same with Medigap plans and compare them a little bit. So what are Medicare Advantage plans? Medicare Advantage plans, like an HMO or PPO, is another way to get your Medicare coverage. Medicare Advantage plans are called Part C or MA plans. They're offered by Medicare-approved private companies and must follow rules set by Medicare. If you join an Advantage plan, you'll still have Medicare, but you'll get your Part A and Part B from Medicare Advantage plan, not original Medicare. You'll generally get your services from a plan's network of providers. And remember, in most cases, you must use your card from the Medicare Advantage plan to get the covered services. Both on Medicare.gov and in the book, there's some excellent points on what you should know about Medicare Advantage plans. As I just described, Part C wraps A and B together, and often Part D as well. Here's a couple points right out of it, and it's also listed in, I think, 13 pointers on Medicare.gov. First, you must follow plan rules in an Advantage plan. It's important to check with the plan for information about your rights and responsibilities. If you go to a doctor or healthcare provider or supplier that doesn't belong to the plan network for non-emergency or non-urgent care services, your services may not be covered or your costs could be higher. In most cases, this applies to Medicare Advantage HMOs and PPOs. Here's a huge point with Advantage plans. Providers can join or leave a plan's network anytime during the year. Your plan can also change the providers in the network anytime during the year. If this happens, you may need to choose a new provider. That's a huge negative in my mind. I tend to stay with my providers if I find one that I like, as long as I can. Last point on Medicare Advantage plans, they have a yearly limit on your out-of-pocket costs for medical services. Once you reach this, you won't pay anything, but typically Advantage maximum out-of-pocket costs are very, very high, and that leaves a lot of room to have unexpected costs throughout the year for medical care. So that's a high-level overview of Part C or Advantage. I'm going to give you the same overview of Medicare Supplement Insurance or Medigap. This comes directly from Medicare.gov. It says that Medigap policies offer coverage for services that original Medicare doesn't cover. It's the area where I said you need secondary insurance because A and B are not enough. 8 things to know I'm not going to cover them all. I'm going to hit the highlights just like I did with Part C. You do have a monthly premium for these. They're typically not very exorbitant. So I mean, I can get these for you in 5 minutes if you just give me a call. A Medigap policy only covers one person. So if you or your husband or wife also would like a policy, you each need your own. However, many carriers provide a discount for having more than one policy or more than one person over 65 in the same household. So there are discounts for that. You can buy a Medigap policy from any insurance company that's licensed in your state, and obviously they need to be licensed in your state. So if it's available, they have been reviewed by your state or Commonwealth. Any standardized Medigap policy is guaranteed renewable even if you have health problems. This means the insurance company cannot cancel your policy as long as you pay the premium. Very important. Once you have this, if you get ill, you can keep it so long as you continue to pay for it. How do you compare policies? Well, according to Medicare.gov, every policy must follow federal and state laws designed to protect you. And these are huge points. All policies offer the exact same benefits. So you can choose which one meets your needs. That's a big point. I'll show you the coverage. You can find this everywhere on my website on Medicare.gov. That shows all of the plans, and they are listed A through N. Those are standard. So an A plan with Aetna is the same as an A plan with United Health or with Cigna. You can evaluate them very easily because it's mandatory that these are standardized plans. They provide the exact same benefits. Most important point that I'm going to make all day is when can you buy a Medigap plan? Again, according to Medicare.gov, the best time to buy a Medigap policy is during your 6-month Medigap open enrollment period. During that time, you can buy any Medigap policy sold in your state, even if you have health problems. This period automatically starts the month you're 65 and enrolled in Medicare Part B. After this enrollment period, you may not be able to buy a Medigap policy. So, obviously, very critical date. Let's say, for example, you do have a health issue when you turn 65 and elect Part B. You can select the best Medigap plan for you and your family without any underwriting. That may be the only time you ever get to do that. So very, very critical date. That's a high-level overview of Medigap plans, how they can protect you as secondary insurance to make sure that with A and B, you're protecting your family's financial well-being. Last thing I'm going to do, I'm going to go through just a quick analysis, and I found this on Consumer Reports of Medigap versus Medicare Advantage. A couple side-by-side examples. You can Google this. It's available without subscription. So this compares Medigap to Part C. Premiums. Medigap, it says, and this is from 2014, by the way. They vary $150 to $200 a month for Medigap. I see them far lower than that, under $100. And then Medicare Advantage, it's saying a 0 to 100. Well, typically these are offered with low premiums, but they have often really high maximum out-of-pocket costs associated with them. So, don't be deceived by that premium payment alone. Certainly don't. Second thing, out-of-pocket costs. Medigap has low to none. You basically try to take the fluctuations or uncertainty out of the Medicare costs with the plan that you select. On the Medicare Advantage side, in-network medical deductibles and copays of up to $3,400 to $6,700 a year. Again, this is a couple years old, so big difference there. You're with the Medigap plan. Planning to control your costs. Medicare Advantage, you have a lot left to uncertainty. Here's a big difference. Choice of doctors and hospitals. With Medigap, you can choose any provider that participates in Medicare. Any provider. That's a big benefit. On the Medicare Advantage side, you have HMOs, where you're restricted to a plan provider, which could change through the year, as I just went through. You have PPOs, which you can select any provider, but out-of-network providers may cost more. So lots of restrictions on Medicare Advantage side that are not there with Medigap. When can you buy? Medigap plan, first 6 months after you sign up for Part B and or at least 65 years old. On a Medicare Advantage, when you first enroll in both Medicare A and B, and annually thereafter, occurring during open enrollment from October 15th to December 7th. That's the big flurry of activity we hear about every year, and it's a big analysis of what people have for secondary insurance. And not always necessary, certainly with Medigap. Medigap you can change at any time, but you may have to qualify for it after that initial enrollment period. Last point of comparison, paperwork. Medigap plan, according to this article, says little to none. Medigap almost always automatically cuts a check to providers after Medicare pays its share. So you get your service, Medicare pays their part, Medigap pays their part, and you're not in the middle of that. On the Medicare Advantage side, it says some because you pay deductibles and copays directly to providers. So a nice little analysis between the two. You would be well advised to analyze which is the best option for you. We'd be very happy to work with you to try to make that decision. You can also work with your particular state's SHIP program. Many, again, like Ohio, they have very good ones, but I believe they have thin staffing, but you certainly can reach out for them or call me. Happy to help. David Treadway, Precision Retirement Planning, 937-506-0591, or David at medsup.net, medsup.net, or David at precisionretirement.com. Thank you very much for your time today. I appreciate it. Hope you have a wonderful day.